Hi there, my name's Andrew, I'm one of the final year medical students. Could I just confirm your name and age, please?
Yeah, my name's Robert Brown and I'm 21.
Nice to meet you, Robert. Today I've been asked to examine your cranial nerves. These are the nerves that supply your face and your neck. Would that be okay?
Yeah, that's fine.
Brilliant. Are you in any pain at all?
I'm in no pain.
Okay. First of all, Robert, I'd just like to check, have you noticed any change in your sense of smell at all?
No, I haven't.
Okay. Now I'd like to test your vision. Would that be okay?
That's fine.
I'd now like to assess your visual acuity. Do you usually wear glasses, Robert?
No.
Okay. If you could cover one eye with the palm of that hand, and starting at the top, I'd like you to read down as far as you can on the Snellen chart in front of you.
E H N D F N P T X Z U Z D T F D F N P T H P H U N T D Z N P X T Z F H.
Fantastic. And if you could cover the other eye and do the same.
E H N D F N P T X Z U Z D T F D F N P T H P H U N T D Z N P X T Z F H.
Brilliant. I'd now like to assess your pupils. This will involve shining a bright light into your eyes. Would that be okay?
Yes.
Brilliant. If you could just pick a point on the wall in front of you and keep looking at that. That's great. I'd now like to swing the light between your eyes. If you just keep looking at the point on the wall in front of you. Finally, I'd like to assess the ability of your eyes to focus. If you could look at the point on the wall in front of you. And now look at the pen. That's great. Robert, I'd now like to do some specific tests of your vision. If you could just keep looking into my eyes, I'd like you to point at the finger you see moving. Brilliant. I'd now like to test your visual fields. If you could just cover one eye with the palm of that hand for me, I'm going to cover the opposite eye. Let me know when you see my finger moving. Keep looking into my open eye.
Yes. 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 Yes.
Cover the opposite eye for me. Same again.
Yes. 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 Yes.
Brilliant. I'd now like to assess the movements of your eyes. First of all, have you got any double vision at the moment?
No.
Okay. Do let me know if you have any double vision throughout the exam. But I need you to keep your head perfectly still, and I'd like you to follow my finger. Did you have any double vision at all?
No.
Okay, fantastic. Okay, I'd now like to assess the sensation on your face. First of all, I'll start with a piece of cotton wool and then a small neurotip. Would that be okay?
Yes.
Brilliant. This is what the cotton wool feels like. Can you feel that?
Mm-hmm.
Brilliant. If you could just close your eyes and let me know when you feel the cotton wool on your face.
No. 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 No.
And did it feel the same on both sides of your face?
Yes, it did.
That's great. I'm now going to assess it with this neurotip. Can you feel that?
Yes.
Fantastic. Again, if you could close your eyes for me.
No. 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 No.
And again, did it feel the same on both sides?
Yes, it did.
That's great. Okay, I'm now going to feel some of the muscles around your face now. Just clench your jaw for me and relax. Clench your jaw for me and relax. Open your mouth and don't let me close it. I'm now going to assess a reflex, if that's okay. What I'd like you to do is just relax your jaw down slightly for me. I'm just going to place my finger on your chin. Fantastic. So I'd just like to assess some movements of facial expression now, Robert. First of all, can you start by raising your eyebrows? Great. And now if you can close your eyes as tight as you can and don't let me open them. If you can puff out your cheeks, don't let me push them in. You can purse your lips for me and bare your teeth. That's great, thank you. 2 quick questions for you, Robert. Firstly, have you noticed any change in your taste at all?
No.
Okay. And secondly, have you noticed that your hearing sounds louder than usual?
No.
Good. Robert, I'd now like to assess your hearing, if that's okay. To start with, I'm going to place one hand on one ear and I'm going to whisper a number or a word into the other ear. I'd just like you to repeat it. Okay?
66. 79.
Fantastic. And just the same on the other side.
83. 97.
That's great. So I'm now going to use the tuning forks to assess your hearing. First of all, I'm going to place the tuning fork on the bone behind your ear. I'd like you to let me know whether you can hear it and when you stop hearing it.
Okay.
Can you hear that?
Yes.
Let me know when it stops.
It stopped.
And can you hear that?
Yes.
I'm just going to do the same on the other side. So I'm now going to place the tuning fork in the middle of your forehead. Can you hear that, Robert?
Yes.
And is it loudest in one ear or the other or in the middle?
In the middle.
That's great. I'd now like to assess the nerve that assists with your balance. And now I've got you standing up. What I'd like you to do is close your eyes and I'd like you to march on the spot for me. That's great, you can stop now. Robert, if you could just cough for me. Finally, if you could just take a sip of this water. And when you're ready, swallow. So now I'd like to just assess the power in your shoulders and your neck. Robert, if you could just start by shrugging your shoulders for me and don't let me push them down. Fantastic. Now if you could turn your head to the right against my hand and don't let me stop you. Fantastic. Turn your head to the left against my hand and don't let me stop you. That's brilliant. So I'd now like to examine your tongue. First of all, if you can just open your mouth for me. That's brilliant. And if you can stick your tongue out. Fantastic. Now if you can just press your tongue into my fingers. And the same on the other side. Today I did a cranial nerve exam on Robert Brown, a 21-year-old male. On examination of cranial nerves 1 to 12, there were no abnormalities detected. To complete my examination, I'd like to do a motor and sensory exam of both the upper and lower limbs.